Hello there.
Hi.
Is it Miss Platt?
Yeah.
My name's Gavin Britton. I'm one of the medical doctors in clinic today.
Okay.
I've been asked to have a discussion with you about abdominal pain. Would that be alright?
Yeah, that's fine, yeah.
Can you tell me a bit more about this abdominal pain?
So when I'm eating, I keep having to rush to the toilet because I'm getting really bad cramping in my stomach.
Okay.
And then it's making me really tired. I'm sleeping a lot.
So, and when did this start?
About a few months ago, really.
Okay. So it's been going on for a few months. And,
Yeah.
Is it worse more recently, or?
Yeah, definitely. And it's as soon as I've ate as well. And I'm really struggling with certain foods.
Okay. And which foods is it?
Like pastas and like breads and stuff like that, and dairy products as well, milk.
Okay. Fine. And have you noticed any other changes?
I've got a diagnosis of arthritis already, but I've noticed that that's getting worse as well.
Okay.
Yeah.
And in what way is that getting worse?
My back pain, and it's just making me really tired because I'm in so much pain.
Okay. And are any of your other joints affected?
My wrists as well, but no, not apart from that.
And are your wrists flaring up currently as well?
Yeah, I think so.
Okay, fine. Is there anything else you've noticed currently?
No, not really. I get undigested food when I'm going to the toilet and I'm losing a lot of blood.
Okay, so when you open your bowels, is that loose or formed still?
Most of the time it's loose, but I'm noticing sometimes I can go for weeks without going to the toilet as well. It's just changing all the time.
Okay, and currently is it loose or?
Yeah.
And approximately how many times a day are you having to go to the toilet?
Probably about 8 times a day, but I can be on the toilet for hours.
And is the blood mixed in with every motion, or is it more on the paper or in the pan?
No, it's mixed in.
Mixed in?
Yeah.
Is there any mucus in the stool?
Yeah.
Okay, fine. You mentioned that there's some undigested food. Is that within the stool or is that vomiting?
It's within the stool.
Within the stool.
Mm-hmm.
Are you vomiting at all?
No. I do feel sick quite a lot, but I don't vomit.
Okay.
Mm-hmm.
Have you noticed if you've had any fevers or hot flushes?
I get a lot of hot flushes at night time.
Okay.
Yeah, and it tends to wake me up in the middle of the night.
Okay. And any changes to your weight recently?
I do think I've been losing a little bit of weight.
Do you know if have you weighed yourself?
I've lost a few kilograms.
A few kilograms over what sort of time period?
Over a few weeks. Yeah,
Okay.
about a month.
Has there been any changes with your appetite?
My appetite just changes, so sometimes I tend to binge eat quite a lot, and then other times I won't eat anything at all.
Okay. Any difficulty with swallowing?
No.
Or any problems in the mouth, such as ulcers or sores?
I have had ulcers in the past, but it's not been a big issue for me.
Not currently, okay.
No.
Any changes with your eyes, such as pain, grittiness or redness?
Well, I've had uveitis in the past.
Okay.
And my eyes tend to get really bloodshot, and I do get a lot of pain, especially when there's bright lights and if I go outside from being inside and it's really light.
And is that currently you're having those problems?
Yeah.
Okay, fine. So we've touched on a couple of things there, but in terms of the background to your condition, do you have a known diagnosis? Have you been given a diagnosis for all these problems?
No, not yet.
No. And have you tried any treatments in the past?
I've had methotrexate in the past, and I'm on azathioprine at the moment.
Okay. And that's to control the eye symptoms and the abdominal symptoms?
Yeah, and the joint pain.
Okay, fine. Do you have any other medical problems?
I've got fibromyalgia as well, and I've got POTS, so it's postural orthostatic tachycardia syndrome.
Fine.
Yeah.
Okay.
And hypermobility syndrome.
And in terms of medications that you take, is there anything that you take every day?
I take gabapentin as well.
Okay.
Yeah.
Anything else?
Sertraline.
Okay.
Omeprazole for gastro reflux.
Okay.
Yeah.
Any others?
No, that's it.
Anything over the counter or any injections?
No.
No. Okay, fine. Do you have any allergies?
No.
No. Can I ask, do you smoke?
No.
Ever smoked?
No.
No. And do you drink alcohol?
Yeah, occasionally.
How much in a week roughly would you drink?
Not a lot. I notice that when I do drink alcohol, it makes my symptoms a lot worse.
Okay.
I'd say a couple of glasses of wine at the weekend.
Fine. Okay. And do you work currently?
Yeah.
What?
I'm an assistant psychologist, so yeah.
Has this affected your work at all?
Yeah, because I'm having to leave work a lot to go to the toilet, and I'm spending a lot of time on the toilet during the day, so
Okay.
yeah.
Is there anything that runs in the family?
My auntie has bowel problems, but there's no diagnosis.
Okay.
Yeah.
Any joint problems or eye problems in the family?
Just fibromyalgia.
Okay, fine. What I'd like to do now, if it's okay with you, is have a look at your abdomen. So if I can ask you to just step round onto the couch.
Yep, that's fine.
Could I have a look at your hands? Do you have any pain in your hands or wrists?
Yeah, a little bit here and in between my knuckles.
I'll just have a quick feel if that's okay. Do let me know if it's sore.
Okay.
Is that sore?
A little bit, yeah.
Okay, and then the other side.
That's okay.
If I squeeze across here, is that sore at all?
A little bit. Yeah.
There. Anywhere else?
Yeah, there. That's okay.
Okay, and then this side.
A little bit.
And what about here?
No, that's fine.
They're okay.
They're okay, yeah.
And then on this side, is that okay?
Yeah.
Any pain there?
That last one's a bit sore.
Okay, and there?
That's alright.
Okay.
That's a bit tender there.
That's a bit sore.
Yeah.
And that one?
That's okay.
If I ask you to turn your hands over, and if you stretch your fingers right back, that's it. And then if you turn this hand back over, I'll just have a look at this finger. Okay. And put your wrists up like that. And you can relax that hand down. I'll just have a feel of this wrist. Can you peel one eyelid down for me? Okay, and relax. And open your mouth. Tongue up to the roof of your mouth. Okay. And if you sit forward for me, I'll have a feel of your neck. Okay, and then the other side. I'm just going to lie the bed flat.
Okay.
And if I could have a look at your abdomen.
Yeah.
Do you have any pain at the minute?
Yeah, it's in the middle and over the left side.
Would you mind if I have a feel of your
No, that's
abdomen?
fine.
Please do let me know if it's uncomfortable.
Yeah, it's quite tender there.
Okay.
In there. Yeah.
Okay. I'm just going to have a feel a little bit deeper, but do let me know if it's uncomfortable. Okay. If you can take a few breaths in and out. And again, breathe in and out. Okay. You're able to roll towards me. Just breathe in and out. And again. And roll back. Thank you. I'll have a feel around this side. And on this side. Okay. just going to tap over your tummy now.
Okay.
And if you can roll towards me. It's okay, and roll back. Have a listen. Okay. Have you had any rashes on your body or legs?
No, not that I've noticed.
I'll just have a look at your legs.
Okay.
Is there any pain in your feet?
They're just a bit achy.
Any pain here?
No.
Or here?
A little bit tender.
Here?
No, that's okay.
Or here?
No, that's alright.
Okay. I can just ask you to sit forward and I'll have a look at your back. I'm going to have a feel down the spine if that's okay.
Yeah,
Are you in any discomfort at the minute?
Just at the lower part of my back.
Okay. Do let me know if this is uncomfortable.
Okay.
Is that okay?
Yeah, just that lower one here.
Okay. Let's have another feel at the bottom. Is that sore at all?
Yeah.
Okay. And if you want to pop your t-shirt back on,
Yeah.
I'll just stand up for you.
Okay.
Okay, if I could ask you to do a few movements with your head. If you can put your head up towards the ceiling, down towards your chest, put your ear onto one shoulder, and then on the other shoulder. Turn your head to one side, and then the other side. Okay, and then just come back to the middle, and then with one hand run it down the side of your leg as far as you can go, and then the other side. Okay, and if you can bend forward and try and touch your toes. Yep, and then stand back up and stretch backwards as far as you can go. Okay, and then have a seat back on the bed. To complete my examination, I'd like to examine the hernial orifices, perform a digital rectal examination and urinalysis, as well as get a baseline set of observations. Thank you for letting me examine you today, Miss Platt. Is there anything that you're overly concerned about?
I'm just really worried about these bowel symptoms because obviously they've been getting worse over the past 10 days and I'm in a lot of pain and I'm spending a lot of time on the toilet as well.
Okay. What I'd like to do, if it's okay with you, is perform some further investigations.
Okay.
I'm thinking that the background symptoms you've had with the eye discomfort and the uveitis that you've described, along with the joint pains that you had, might well be related to the symptoms you're having in your abdomen at the minute.
Right.
There is a condition called inflammatory bowel disease that is linked with these symptoms, and more specifically, because of those other symptoms you've had, including the mouth ulcers, there could well be a condition called Crohn's disease that you have, and I'd like to perform some more investigations for that disorder. Initially, however, I feel that your abdominal symptoms currently are troublesome enough to need to admit you to hospital, and I'd like to manage those symptoms in the first instance before we look into the background inflammatory bowel disease, if that's okay.
Okay.
So what I'd like to do, with your permission, is admit you to hospital, give you some pain relief and intravenous fluids, perform some blood tests and an x-ray of your abdomen, give you some intravenous steroids and potentially think about giving you some intravenous antibiotics as well.
Okay.
After that, we may well need a camera test looking at the colon and the large bowel to assess for the extent of inflammation, and then we can take things from there.
Okay, thank you.
Do you have any more questions or concerns?
No, that's it, thank you.
Thank you very much.